Good morning. It's Robert Young with Magnolia City Health Insurance. I'm here to talk to you today about really kind of the difference between an HMO and a PPO. Currently, we're right in the middle of open enrollment. And open enrollment really is when the government signs up everybody for new health insurance plans for the oncoming year. In this case, it's 2025. So I wanted to bring to you today a little bit about the differences. When the government offers you plans on the ACA market, or the marketplace as it's often referred to, is many of the plans on there are HMOs, which is a health maintenance organization. That's what HMO stands for. And those plans, you are assigned a primary care provider, a doctor that is the person who's navigating you to any sort of specialist that you need of any kind. If you need an eye doctor, he actually has to write a referral for you to go see an eye doctor. If you need to see a cardiologist, same thing. Your primary care provider has to write you a referral to go and see a cardiovascular doctor of his choice and his network that is in the HMO network that you design. So you're really not getting to choose the doctor and or hospital in that case that you may be with. And if you're in network, oftentimes with an HMO, then some of the cost can be a little bit lower, but your actual plan, your HMO plan with the government, your deductible and out-of-pocket expense for a total of max out amount may be very, very expensive. Contrary, on a PPO network, a preferred provider organization, in that case, you have the flexibility to choose your doctor and or hospital. And then if you need to see a specialist like an eye doctor, cardiovascular doctor, orthopedic surgeon, pediatric surgeon, for your kids or whatever it may be, you get to choose. So if you have that family doctor that has been in your family for years and you want to take for your kids and you like them, you've built a reputation, or you've taken care of took care of you, all of them, and that's the person you want to see, then in a PPO network, you're like, hey, I'm going to go see him, and that's the one that you can choose and go see that one. Now, in a PPO network, especially with the network that I work with, which is United Healthcare Choice Plus Network, that's the largest network in the country. 98% of doctors and hospitals are in that network. Now, if by chance you find a doctor that is not in that network, what does that mean? Well, that means that you're just not going to get the discount that network provides. In the PPO network, you'll still be able to use that doctor, but your dollar won't stretch as far. In an HMO plan, more than likely, you won't get any sort of, the insurance won't pay for that doctor out of network at all. That's all on you. So that's one of the main differences between a PPO and HMO. Whereas a PPO network, it will still pay that doctor out of network, but you just won't be able to stretch your dollar as far. And the other thing is, if you heard me mention, 98% of doctors and hospitals across the country. That means if you are, let's say, from Virginia, and you got your plan in Virginia, and you go into Washington, D.C., or you go to another state, you go to Florida, Maine, any other state in the United States, including Alaska and Hawaii, you're still covered. You still maintain your coverage. If you got a HMO plan in the state of Virginia, through the government, either the county or the federal government, on the ACA marketplace. As soon as you travel outside of the state of Virginia, your coverage doesn't travel with you. You're no longer covered. So if you go on vacation to California or Florida or the South Carolina, North Carolina coast, you have no health insurance. And if you have an accident, then you're on the hook for all of that health costs. With a PPO network, then you have the bona fide backup there that even though you cross straight lines, your health coverage travels with you and you're covered. So I hope that my little bit longer of explanation here between an HMO and a PPO are helpful here. I didn't cover budget on that because cost, depending on the plan that you get and the deductibles and the out-of-pocket costs, they can vary. I will say this on cost. If you get a PPO plan and you meet that, more than likely in the long run and when it counts, your costs are going to save you a lot more money than what the HMO will. That has been my experience of what I've seen being in the health insurance industry and on that. So I'm Robert Young, Magnolia City Health Insurance. If you'd like to learn a little bit more and want to book some time with me to discover it, just give me a call below. I'd be happy to discuss your situation with you. Robert Young, Magnolia City Health Insurance.